Good day, students. This will be your discussion video for Psychology 104N or Developmental Psychology subject. For this video, we will be talking about prenatal development. So the prenatal development starts with the fertilization of the egg and sperm cell and ends with birth. So this takes between 266 to 280 days or 38 to 40 weeks or approximately 9 months. This entire duration can be divided into 3 periods, namely germinal, embryonic, and fetal. So the germinal period is the period of prenatal development that takes place during the first 2 weeks after conception. So this includes the creation of the fertilized egg, called a zygote, cell division, and the attachment of the zygote to the uterine wall. Implantation, the attachment of the zygote to the uterine wall, takes place about 11 to 15 days after conception. The embryonic period is the period of prenatal development that occurs from 2 to 8 weeks after conception. So during the embryonic period, the rate of cell differentiation intensifies. Support systems for cells form and organs appear. So as the embryo's 3 layers form, which is the following: the endoderm, mesoderm, and ectoderm, these life support systems for the embryo develop rapidly. 4 chambers of the heart take shape and blood vessels appear. From the 5th to the 8th week, arms and legs differentiate further. At the same time, the face starts to form but still is not very recognizable. The intestinal tract develops and the facial structures fuse. At 8 weeks, the developing organism is just over 1 inch long. The fetal period, lasting about 7 months, is the prenatal period between 2 months after conception and birth in typical pregnancies. Growth and development continue their dramatic course during this time. So here is the detailed illustration of the 3 trimesters of prenatal development. This is an overview of the main events of what to expect each week or trimester. Trimester means equal periods of 3 months, but take note that this is not the same as the 3 prenatal periods that we have discussed beforehand. The germinal and embryonic periods occur in the first trimester. The fetal period begins toward the end of the first trimester and continues through the second and third trimesters. Teratology and hazards to prenatal development. So let's define first what a teratogen is. A teratogen is any agent that can potentially cause a birth defect or negatively alter cognitive and behavioral outcomes. So it is important for pregnant women to know what possible teratogens can cause harm to the fetus to avoid any defects after giving birth, or in worst cases, to avoid fetal death inside the womb. So here are the important reminders to take into consideration once the person is being exposed to a teratogen. So first, the dose. So it is obvious that the greater the dose of an agent, like for example a drug being taken by the pregnant woman, the greater its effect to the fetus. Second, genetic susceptibility. So there are instances wherein the genetic composition of the pregnant woman could have adverse effects to the embryo or fetus once she is being in contact with a specific teratogen. Third, time of exposure. So the embryonic period is known to be one of the most critical periods of prenatal development, and if the pregnant woman is being exposed to these teratogens, it can cause more damage at some points in the development. The following are psychoactive drugs that are considered to have negative effects on the fetus. The pregnant woman should avoid the above-mentioned psychoactive drugs to keep the fetus healthy. Avoid caffeine, alcohol, nicotine, cocaine, marijuana, and heroin. Incompatibility between the mother's and father's blood types poses another risk to prenatal development. So if a pregnant woman is an Rh negative and her partner is Rh positive, the fetus may be Rh positive. So if the fetus blood is Rh positive and the mother is Rh negative, the mother's immune system may produce antibodies that will attack the fetus. So this can result in any number of problems like miscarriage or stillbirth, anemia, jaundice, heart defects, brain damage, or death soon after birth. Many aspects of our modern industrial world can endanger the embryo or fetus. X-ray radiation, environmental pollutants, and toxic waste are also sources of danger to the unborn child. Among the dangerous pollutants are carbon monoxide, mercury, and lead, as well as certain fertilizers and pesticides. So far, we have discussed a number of drugs, environmental hazards, and incompatible blood types that can harm the embryo or fetus. So here, we will explore other characteristics of the mother and father that can affect prenatal and child development, including nutrition, age, and emotional states and stress. First, maternal diet and nutrition. So a developing embryo or fetus depend completely on its mother for nutrition, which comes from the mother's blood. The nutritional status of the embryo or fetus is determined by the total calorie intake by the mother, as well as her intake of proteins, vitamins, and minerals. Children that are born to be malnourished are more likely to have some malformations after birth. Second, maternal age. So this is linked to the risk for adverse pregnancy outcomes. So when a pregnant woman is older than 35, there is an increased risk that her child will have Down syndrome. However, when the mother reaches 40 years of age, the probability is slightly over 1 in 100 that a baby born to her will have a Down syndrome. When mothers are 35 years and older, risks also increase for low birth weight, preterm delivery, and fetal death. Third, emotional states and stress. So when a pregnant woman experiences intense fears, anxieties, and other emotions or negative mood states, physiological changes occur that may affect her fetus. So a mother's stress may also influence the fetus indirectly by increasing the likelihood that the mother will engage in unhealthy behaviors such as taking drugs and receiving poor prenatal care. And lastly, paternal factors. So men's exposure to lead, radiation, certain pesticides, and petrochemicals may cause abnormalities in sperm that can lead to miscarriage or diseases such as childhood cancer. So the father's smoking during the mother's pregnancy also can cause problems for the offspring. Paternal smoking around the time of the child's conception was linked to an increased risk of the child developing leukemia. The birth process is being divided into 3 stages. The first stage is the longest of the 3, wherein uterine contractions are 15 to 20 minutes apart at the beginning and last up to a minute. The second birth stage begins when the baby's head starts to move through the cervix and the birth canal. After birth is the third stage, at which time the placenta, umbilical cord, and other membranes are detached and expelled. In the Philippines, the Department of Health released an administrative order 2008-0029 entitled Implementing Health Reforms for the Rapid Reduction of Maternal and Neonatal Mortality, and was unofficially dubbed as the No Home Birthing Policy, because the administrative order and its manual of operations states that all pregnant women should give birth only in facility-based centers. These are defined as hospitals, lying-in centers, and birthing facilities. They should also be attended by skilled health personnel, which are identified as a doctor, nurse, or midwife with proficiency in managing pregnancy and childbirth, including the appropriate management of complications that might occur. So during the method of delivery, the mother and her obstetrician may opt for these options depending on what is appropriate to the situation that could have a successful delivery of the baby and at the same time safety to both mother and child. There are three basic kinds of drugs that are used for labor, which are the following: analgesia, anesthesia, and oxytocin. So analgesia is used to relieve pain. Anesthesia is used in late first stage labor and during delivery to block sensation in an area of the body or to block consciousness. While oxytocin is a hormone that promotes uterine contractions. Natural childbirth is the method that aims to reduce the mother's pain by decreasing her fear by providing information about childbirth and teaching her and her partner to use breathing methods and relaxation techniques during delivery. In a cesarean delivery, the baby is removed from the mother's uterus through an incision made in her abdomen. Cesarean deliveries are performed if the baby is lying crosswise in the uterus or if the baby's head is too large to pass through the mother's pelvis, or if the baby develops complications or maybe the mother is bleeding vaginally. So cesarean delivery must be conducted. Once the baby is delivered, the Apgar scale is widely used to assess the health of newborns at 1 and 5 minutes after birth. The Apgar scale evaluates an infant's heart rate, respiratory effort, muscle tone, body color, and reflex irritability. An obstetrician or a nurse does the evaluation and gives the newborn a score or reading of 0, 1, or 2 on each of these 5 health signs. Please take note that a total score of 7 to 10 indicates that the newborn's condition is good. A score of 5 indicates there may be a developmental difficulties. A score of 3 or below signals an emergency and indicates that the baby might not survive. Some women develop postpartum depression, which involves a major depressive episode that typically occurs about 4 weeks after delivery. Women with postpartum depression have such strong feelings of sadness, anxiety, or despair that for at least a 2-week period, they have trouble coping with their daily tasks. So without treatment, postpartum depression may become worse and last for many months. A mother's postpartum depression can affect the way she interacts with her infant. So several caregiving activities also are compromised, like including feeding, especially breastfeeding, sleep routines, and safety practices. The father's support and caring can play a role in whether the mother develops postpartum depression. So that ends my discussion video of this particular topic. Kindly check other discussion videos here on this YouTube channel. I've also posted the specific links in our Google Classroom for you to be guided. So if you have questions or clarifications with regards to this specific topic, kindly contact me through my University of Bohol Facebook account. Thank you for your attention.